And today we're going to interview someone who says, I'm not a healthcare professional.
By professional background, I'm actually a certified public accountant. WebMD meets Match.com, Home Advisor, LinkedIn, helping people connect the dots between our agricultural system, the soil, the food, nutrition, both digitally and in alignment with Natural Awakenings in print. We have about 1.3 million readers across the United States.
No, I was just going to say, I got to go take a nap just from listening to everything you did. It's unbelievable. Welcome to the Wellness Podcast. This is Hugh Light USA, and please be sure to subscribe to our channel for lots of content. We upload a new episode of the Wellness Podcast every month. So stay tuned because you're going to love the content and love the people that we interview each time. I'm Dr. Mitch. I'm the Chief Medical Officer of Hugh Light USA, and today we're going to interview someone who says, I'm not a healthcare professional. That's what she told me earlier. But yet, wait till you hear the story of what this woman has accomplished in her lifetime, how she paid forward her difficulties, her challenges, and put that into something that's so amazing. Her name is Kimberly Whittle. Kimberly Whittle has a company, and the company's name, I'll look and say it right, is KnoWewell. It's not K-N-O-W, it's K-N-O-W-E, KnoWewell, Inc. And the story you're about to hear will not only amaze you, it will challenge you, and it will inspire you. Thank you so much for joining us, Kimberly. I am so happy that you're here, and this is going to be a fun time to be with you. It's going to inspire me because I don't even know the whole story, and I think that's great. Thank you.
Thank you, Dr. Mitch. It's an honor to be with you today. Thank you for having me.
I think the honor is more of mine because I get the great opportunity to talk to people that have done so much great things in your life. Who's Kimberly Whittle? Let's start with the easiest question of the world because our viewers are saying, who is she? What is she? What's KnoWewell? Give us a little background.
Thank you. Well, I'm the founder, as you said, of KnoWewell. It's actually a public benefit corporation, and we operate the regenerative whole health hub. So think WebMD meets Match.com, Home Advisor, LinkedIn, Facebook, Amazon, all in one for this industry of regenerative whole health. Regenerative, starting with that regenerative organic agriculture and helping people connect the dots between our agricultural system, the soil, the food, nutrition, people, and planet health. But as you said, I'm not a health professional. By professional background, I'm actually a certified public accountant, fast-tracked through the Big Four, external audit, ran some multi-billion-dollar audits of like L'Oreal and Bed Bath & Beyond, and moved over into Fortune 50 companies and compliance, and then back onto the consulting side, helped grow one of our small clients into the largest client in the Northeast and ran a $60 million SAP ERP implementation. And then after that, co-founded my own consulting firm, grew it profitably into a global firm. That's my left brain, right? That's where I thought the journey was going for the rest of my career. But as most people in this industry, God had a different plan for me. And I'm blessed today to know what my purpose is. But along that, sorry.
No, I was just going to say, I got to go take a nap just from listening to everything you did. It's unbelievable. Let me bring you to the healthcare space because you said it's from soil, from this, from that. Explain for our viewers what you mean, and then we'll segue to the Awakenings magazine that anyone that's ever gone to a health food store knows exactly what that is. But let's start with, what started this? What brought you to start looking at these different, this healthcare space?
So during that professional career period, 15 years of miscarriages, I was just about to do IVF treatment, and a friend said, no, try a detox. And I was like, well, what's a detox? And even though I had to give up my wine and my coffee, I was like, well, it sounds a lot better than doing IVF treatment. So I went for it, and thankfully, successfully was pregnant, was able to maintain it, was incredibly excited. but frightened at the same time. I had been helping to raise my 3 stepsons for 7 years at that point. They each had underlying chronic conditions. I had a nephew the same age as my twins, severe learning disability, and our brilliant friends, partners in top 1%, their children suffering with autism and the autism spectrum. And at that time, there was 1 in 150 children. And I didn't want that to happen to my unborn son. So that's really what drove me to deep dive into the research to see what I could do to hopefully prevent that. With that, read more books, studied more than I did in my entire lifetime, chose a natural childbirth. The blessing in disguise, most people wouldn't say it, was that his head broke my coccyx during my delivery, my medication-free delivery, so definitely not pain-free delivery. But that ultimately, led me to a chiropractor. And then, having to nurse this way and that way, and the fibrous foods that I was taking, and 3 rounds of nystatin. The doctors kept saying we have thrush. It wasn't clearing. And so it was the chiropractor who introduced me to a nutritionist. And the nutritionist said, yes, you have food sensitivities and you've got candida. Here's a homeopathic practitioner. And I said, well, what's homeopathy? But a 2-hour meeting with that, a tiny little kit, and within a week's time, I had the pleasure of nursing my son for the 2 full years.
And how did that lead to, or what led to your first actually dive into bringing, I see where you're going, but what brought you to bring to the public, and how did you do that, this awareness of these health things, and that there is something else other than the conventional drugs, etc.?
Yeah, so that was the beginning of the journey. And thankfully, having been so successful in the first 3 years of my son's life, when my husband came down with a rare autoimmune disease, his skin literally was peeling off of his body all day long, brought him to the same nutritionist, mismatch of personalities. He opted for the conventional route, autoimmune suppressant drugs, which under the circumstances, and I never judge anyone for their choices. It's their own personal choice. But with that, over time, it started to clear the symptoms. And then one day he had a cough. A couple of days later, he ended up in the ICU for over a week and almost died of methotrexate-induced lung injury. And thank God he didn't. But as his lungs began to recover, the disease came back with a vengeance. So they put him on more immune suppressant drugs, which over time did clear the symptoms well enough for him to go back to work. But then with additional adverse reactions, alopecia universale, and severe pseudo-gout pains to the extent that I sometimes had to cut his food. So by that time, I had 5 children, and I was cutting his food in my 30s, and as you can imagine, not very happy. But again, being successful with our youngest, it gave me the confidence to continue searching. I found the Academy of Integrative Health Medicine, Dr. Mimi Granieri, quadruple board certified physician, speaking on the connection between our agricultural system, our people, our planet health, and the tears were just pouring out of my eyes. And I was like, oh my God, you guys are changing the world. Of course, I'll be a dream builder for your organization. And I was equally blessed that Dr. Patrick Hanaway was speaking on functional medicine. And that's where I had my aha moment. I was like, thankfully, I know what's wrong. My husband's got a leaky gut. So I came home, started researching functional medicine, tried to get him into the Cleveland Clinic Center for Functional Medicine in Ohio, which was the #1 place in the country at the time. And unfortunately, they had 1,500 people on the waiting list and couldn't give confirmation of an appointment. So I'm not one to take no for an answer. So I started researching again. I found the Integrative Healthcare Symposium in Manhattan. Dr. Jeffrey Bland, the father of functional medicine, was speaking. And so I attended the conference, stood on my first book line, asked for his help, and he was a godsend of a man. Got my husband and myself appointments at the center. And indeed, after going through all the testing, he had a leaky gut, high levels of mercury toxicity, so came home. I was his life's coach, his personal chef, cooking 3 hours a day. And I will tell you, my husband did not marry me for my cooking skills.
That's hysterical. But you were able to help him through a different mechanism that was normally professed as this is the only way. Immunosuppression and things of that nature, and of course, corticosteroids.
Exactly. Yeah. And after the protocol, it really seemed like it was a complete miracle. He had had eczema to the point where his fingers would bleed for nearly 50 years. It was the first time in his life that it cleared. He was on statins for 10. His primary physician was able to take him off of the statins. And not only did those pseudo-gout pains go away, he got his life's energy back. He started exercising. He lost 30 pounds, doing 2 T25s a day, right? It was a different life. And so, yes, just an amazing, amazing miracle is how it felt in our family. And during that period of time, we don't have enough time in your show today to continue on with all of my stories, but let me just tell you that we've been through so many different difficulties in our life, but the blessing was that through these different whole health healers, one by one in different circumstances with different family members, they helped our family heal. And as I traveled around to these conferences, I listened to the stories of the practitioners being plugged into a system that didn't allow them to be the healers that they went to school to be, and the high levels of costs that they were incurring between insurance and memberships, and then the high level of suicide rate that I was shocked, them and farmers in this country. And then the organizations and the difficulties that they've had over the decades to bring this new knowledge to the forefront. So as my family began to heal and my husband went back to work and my other family members healed as well, I felt this calling. I needed to do more than hand out the books that I was handing to everyone. People would come up an issue and here's a book for you. Here's Dr. Bland's. Here's Dr. Perlmutter's. Here's Dr. Kellyanne. And so, so as my family healed, I formed KnoWewell to pay it forward, to make the journey easier for others, and to pay it back to the professionals and the organizations that helped me and my family heal.
Wow. That's an amazing story. We're going to take that to the next step. If you just joined us, this is Dr. Mitch GHEN, the Chief Medical Officer of Hue Light. You're watching the Hue Light podcast, of course. And my guest today, if you haven't seen it from the beginning, please go back and watch. Her story is something to behold. Her name is Kimberly Whittle, and founded a company, KnoWewell, which has now gone forward to bringing information to a lot of people, and through one specific source that everyone knows, which is the Natural Awakenings magazine that shows up in health food stores throughout the country. So tell us about that magazine, how many subscribers. I know it's free to people. You can go in and pick it up and read it. So tell us a little bit about that journey and where you're going to go from there onward, basically.
Well, let me explain a little bit how the KnoWewell then connects to Natural Awakenings and how Natural Awakenings integrates. So to pay it forward, as I said, right, we formed the Regenerative Whole Health Hub initially as a community for health education to help individuals find this information all in one safe, trusted place, because most people, as we know, didn't have the wherewithal to travel around to different conferences to buy all the health books. And when you and your loved ones are suffering, I didn't believe that anyone else should have to do that. So we soft launched as a community for health education, and shortly thereafter, it was the organizations that said that they loved the platform so much they wanted to be able to manage their own members on it. And one of the unique things that we do is screen the practitioners and screen the businesses. So we were already creating an ecosystem of like-minded consumers and practitioners. And so we pivoted to offer and create the business services and the platform for organizations to be able to manage their members, their students, their faculty, their alum. And over the years, we've been growing this ecosystem now into a hub where they can run their businesses, they can have branded storefronts, they can share all of the unique healing arts that makes them unique in our world. And then we, KnoWewell, we're digitally publishing them in different multimedia formats. We have global directories for live online events, articles, and we have communities now in over 200 health topic groups between integrative, functional, personal lifestyle, and then all of the mind, body, spirit, planet. So a community for everyone based on your interests and your needs, and then, of course, different health conditions as well to help you find today's knowledge so that you can proactively prevent and address the root causes of chronic disease with trusted practitioners who had that information to get to the root cause. So as we went through the years of doing this digital publishing, I happened to be sitting on the board of the Holistic Chamber of Commerce here locally, met the chief operating officer of Natural Awakenings, and he was like, you must meet the founder of Natural Awakenings. The two of you are one. So it was shortly thereafter we decided to collaborate, and then as she looked years later to retire, we have a very similar mission, right? She's for 29 years of publishing a Healthy Living, Healthy Planet magazine, a pioneering magazine in the industry. It just was a natural fit as she looked to retire, for us to merge our families, for KnoWewell to acquire them. But we look at really as a marriage of families with that one same mission. And interestingly, as the market research of most people say, well, print was an industry that was going to go away. But the trends are really that the future and the combination of print and digital together, that there is a higher brand recognition for the organizations that are in there, the practitioners, and it's really about the knowledge that we're sharing, right? And we're helping now disseminate that both digitally and in alignment with Natural Awakenings in print. We have about 1.3 million readers across the United States. It's a franchise market. We have got in 22 states and 50 locations in 22 states. And last year, after the acquisition, we expanded digitally into all 50 states. We now have national state websites for the locations that were not physically located, but with a plan to expand not only nationally, but globally as well.
I like the combination. I'm still one of those, I guess, old codgers that likes to smell a book and read a book. I still like a library, and I have literally thousands of books of myself. I've written 4 textbooks. So for me, to pull a textbook down as opposed to read it online, I'm one of these. I love holding that book. There's something magical about holding that paper or that book. So I'm very impressed that you're doing both. If someone wanted to read the Natural Awakenings magazine, can they get it sent to their home, or they must pick it up at a health food store, or is there a way to get it digitally online if they choose? Could you just give us how to get to that magazine, and how often does it come out? I think it's monthly, but tell us more, please.
It's a monthly magazine. You can pick it up in your local organic natural grocery store, wellness center. The practitioner's office frequently carry them. You can, if you call the main office, we can connect you with a local publisher. If you would like one, you can get it sent to your home as well. And then, yes, online, there's the Natural Awakenings. You can get your local magazines online as well as the national magazine online.
Fabulous. So can you direct us at this moment to a website? Like, for example, our viewers may say, well, I love this idea. How do I get that information if I want to go right now after this interview and go online? What would they go to?
So to get the Natural Awakenings, and you can find all of the local publishers near you, is naturalawakenings.com. And then for KnoWewell, it's, as you said, KnoWewell, KnoWewell.com. The knowledge for we all to be well.
Fantastic. So there's good resources. They now have a trusted resource, and someone who did not enter this particular space because they were a healthcare professional. They entered the space because of their own journey, and they felt that it was necessary to take this information and bring it to the public and bring it to the professional too, I would imagine. A space where you can say, there's this issue, or how do I just stay healthy? And these are the type of subjects I know that KnoWewell, as well as the Awakenings magazine, often goes directly for. So what's the future, Kimberly? Where are we going? What do you see as the visionary that you certainly are? And What can we expect as viewers, as professionals, lay folks? Where are you going to go? Where are we going to go with you?
Well, as I started to say, our mission is to transform healthcare by inspiring and empowering individuals with today's knowledge, resources, and community so that we can collaboratively come together to help people proactively prevent harm, address the root causes of chronic disease, and create happy, healthy, abundant, purposeful living, what we call wealthier living. Not a marketing ploy, truly came out of my personal journey. And so the future is helping not only the individuals heal, but again, those practitioners, those organizations be celebrated for their unique healing arts and providing them with the business services and the technology to run their businesses or run their memberships, or to just have a branded storefront in this one safe hub so that they can share their unique healing arts. And then the future is we've created a KnoWewell Council. It's thought leaders in the industry around the 200 health education communities that we have. They have their branded storefronts. They have tens to hundreds of thousands of followers. We will all be sharing very shortly with our audiences. We anticipate hundreds of thousands of individuals and tens of thousands of practitioners before the end of the year. And then Dr. Arti Chandra, who works with Dr. Bland at Big Bold Health, has agreed to come in, help us get qualified for HSA benefits. And then I have got some contracts in discussion with global healthcare brokers to offer KnoWewell as a health benefit to global employers, a wellness benefit to augment so that we can create happier, healthier employees, right? Reduce the level of depression and turnover in organizations and absenteeism, and really get to the masses and transform our healthcare.
It sounds like your vision, your drive, what you're going for is something that's basically capable of helping humankind so much. You're trying to take today's medicine and transform it to where it really should be, where we can look back to how God has made us and how we heal from a natural perspective as opposed to more synthetic. I love that. And I'm so proud and so happy that you were able to come on with me today. I'm sure all the people watching feel the same way. Kimberly, thank you so much for joining us today. I'm Dr. Mitch GHEN for Hugh Light USA. Thank you so much for joining us.